we have a clinical strategy that's identifying integrating services around people with complex needs so that they can stay at home as long as they possibly can. Key to that, obviously, is the health of their carers.
So one of the first priorities we've had in a STP is to support carers more. So the NHS, the County Council, the voluntary sector, particularly carers in Hertfordshire, have really come together. We're using a central government grant, we've protected it, to provide more services to carers and seek out and recognise carers much sooner than we ever did in the past. And of course, as a council, we've tried to rise to the challenge. So we now employ specialist carer assessment workers who go out in the community, they do carers assessments, and they try to connect carers, because one of the things that carers often tell us is they feel isolated in their caring role and they're lonely and not as healthy as they want to be themselves.
Identifying carers early is crucial, as well as providing support in the community to enable that carer to carry on caring for longer and be more supported. And we've seen that time and time again in the work that we do with the Community Navigator scheme.
I just wanted to say that we have evidence from surveys that informal breaks and support to carers results in an improvement in their mental health. And we would expect this to translate to definite savings for the local health and care system.
So last year we co-produced a new pathway for carers along with carers, staff and local carers charities. Pathway gives 5 steps to providing good carer support, and that is about identifying carers, welcoming carers, supporting carers, involving carers and supporting carers through all sorts of changes that happen within services and within carers' lives.
Working in partnership has been really critical to the success of our initiative to support carers. We've recruited carers champions across adult and children's services in our organisation, and they're given ongoing training and they're fantastic at feeding back to their teams about the support that's available for carers.
So as a part of the partnership in care, we've also introduced carers passports that are available in, again, the acute and the community hospital. We've kept them very similar so that carers can expect a very consistent experience in all the NHS trusts within the STP.
The carers that we've spoken to are very happy that there's a carers champion in the surgeries, especially as they can get more access to flexible appointments, etc. But we also refer them on to the services that they would need.
Carers champions in primary care have enabled a significant shift towards the recognition and respect of this stalwart group of individuals who care for our patients. We understand better now their health needs and the risks that they face, and we're able to provide support for them as individuals and also in small groups.
It's using money from the big lottery to fund the development of 16 carer support hub groups and other activities related to that. And we're on number 14 at the moment, so we've got one in each district plus a few extra.
My parents' surgery has a carers champion. I'm kind of split between a lot of different doctors, different hospitals, different surgeries, and our experience has been very good, very positive. They've always been quite helpful.
I have been to a couple of forums. I appreciate those because actually you get to hear other people's problems and you realise that, oh, I've got the same as them, but I thought I was on my own. So you get to hear, you feel a little more normal and a little less isolated. But also there are times when I think things actually don't work terribly well, and it has been an opportunity to say. I work for the section that's called the training section, mostly with students and from the University of Hertfordshire. So the social work students, the nursing students, we will go along, we'll spend about half an hour with them, talking to them about what it's like to be a carer. I had an assessment for me. I think that was the first one I had, and it was agreed that I could have sitters coming in. When I heard about the scheme making a difference, I actually applied to that for a bike because I thought that would be a way for me to continue to exercise but also actually to be outdoors. And so I was lucky enough to get the bike, and it just feels that I'm free, and it just feels lovely. It's a lovely feeling.